Thank you so much for staying with us. You're still watching Rapid Done right here on Rapid Television, and of course right now it's time for the big conversation. My name is Victor RK.
My name is Martha Alil. Welcome to the 9 o'clock conversation. And today we have a full house.
Yes.
Definitely going to be an amazing conversation.
Definitely. And of course today, as the world marks World No Tobacco Day, declared by the World Health Organization, we turn our attention to a major public health concern: tobacco use and its growing impact, especially among young people in developing countries like Nigeria. Now, according to the WHO, tobacco kills more than 8 million people globally every year, including over 1 million non-smokers exposed to second-hand smoke. The organization continues to warn that without stronger control measures, tobacco use will remain one of the leading preventable causes of death worldwide. Now, in Nigeria, the National Tobacco Control Act 2015 and its regulations are the key legal frameworks guiding tobacco control, banning smoking in public places, restricting advertising, and regulating sales to minors. However, enforcement gaps, rising youth exposure through social media marketing, and the growth of new nicotine products continue to challenge progress. And the Nigerian Center for Disease Control and the Federal Ministry of Health and Social Welfare have repeatedly emphasized prevention, public awareness, and stronger enforcement as key strategies to reduce tobacco-related diseases such as lung cancer, stroke, and heart diseases. And joining us today for this important discussion are two guests from the Nigerian Tobacco Control Alliance Act. Blessing Louis Yashim, who is the Monitoring and Evaluation Project Officer, Nigerian Tobacco Control Alliance. And we also have Bikus Yusuf, the Programs Officer, Nigerian Tobacco Control Alliance. Good morning and welcome.
Good morning.
Good morning.
Thank you for having us.
Welcome to Rapid Done.
Thank you.
I guess I have the stronger weight around here.
Yeah.
We're truly this against one.
Thank you.
All right, so let's begin by getting to understand the core mission of the Nigerian Tobacco Control Alliance and how it supports the Nigerian's implementation of the National Tobacco Act 2015. Let's go to Bless.
Okay, so the Nigerian Tobacco Control Alliance is a coalition of both faith-based organizations, community-based organizations, civil societies that work together in public health, most especially focusing on tobacco control and non-communicable diseases.
Okay.
So what we do is we were the people that pushed for the enactment of the Nigerian Tobacco Control Act and its regulation. And we move around and policy making, and these policy makings are for us to see that public health is being respected, because we've seen the reoccurring problems when it comes to second-hand smoking.
Right.
So we don't just want to fight the people that are smoking, but we also want to protect the people that have been exposed to second-hand smoking. So at NTCA, we work towards making sure that we push for policies, we work with government stakeholders to make sure that they also uphold their own end of the bargain, because as government and we as the people, our lives is in their hands. They are supposed to protect the people. So that is what we do basically at NTCA.
All right.
Wonderful. All right, let's talk about this year's theme for the World No Tobacco Day.
Yeah.
It says unmasking the appeal, countering nicotine and tobacco addiction. Let's have Bilkis talk to us about this year's theme.
Well, this year's theme is apt, given the fact that the appeal has been everywhere and it's actually becoming worse with recent events that have gone viral nationally. Unmasking the appeal, whether you like it or not, the way the product is being portrayed and the persons and faces that you would find using this product, it is critically important that we unmask the appeal. Now, when we talk about nicotine products, this is a product that has been branded and presented like a lifestyle. Like it gives you a sense of belonging, it gives you an identity. If you want to be successful, you're expected to be a part of that. And so unmasking the appeal is simply letting people know the other side of it, letting them see the health risks that comes with it, letting them see the way it affects you physically, mentally, and the way it affects the society in general. So that is why it is important for us to unmask the appeal to young persons. And I don't say youth, I usually say adolescent and young persons, because the sale of this product is even very close to our secondary schools, which we have adolescents there, and so the exposure starts from there.
So you spoke about unmasking the appeal, and one thing that I've always been confused about is on these tobacco packs you see smokers are liable to die young, and in my head I'm saying we have unmasked it enough by letting them know the consequence, you know, a picture of their lungs on the tobacco pack and what have you. So regardless of all of these, you know, measures that have been put in place in the last couple of years, why do you think people still engage in smoking tobacco?
As long as we relate the use and abuse of nicotine products to greatness, to lifestyle, to key persons that we have seen as those that are leaders, it will continue being a menace in the society.
Wow.
Even if an infographic is telling me it's bad, and I see a 60-year-old successful man in an important meeting holding a cigar, of course, will be successful and have belonging in that room, then I have to use tobacco.
Well, really concerning anyways, because we've also seen UNICEF talked about the fact that youth exposure when it comes to social media is one of those challenges that we've seen when it comes to the use of nicotine and tobacco. But let's talk about the enforcement basically. We also see, of course, that the National Tobacco Control Act prohibits smoking in public places.
Yeah.
And if you get out to public places, even today, you just might see someone who is smoking publicly. Why is this enforcement taking a slow pace? I mean, why do we still see people smoking comfortably without any fear, you know, in public places?
Okay, so I think the answer to the question is actually in your question.
Okay.
So you spoke about enforcement. So I feel like that is where we usually have the problem. So Nigeria has laws.
Right.
We have policies, we have regulations. Our problem is always the enforcement.
Okay.
So who do these people even know that we have a law? That's the first thing. A lot of people do not know that we have these laws. They don't know that we have these regulations. They don't even know that they are violating these regulations. So now it is not for us as civil societies to enforce them. It is left for the governments to make sure that these laws are being enforced.
That's right.
And in the National Tobacco Control Acts and Regulations, we see that we have the bodies that are supposed to do the enforcement. But are they being told that they are supposed to do this enforcement? The people that are supposed to do the enforcement are also violating the laws.
Right.
Yes, and then when we talk about smoking in public places, it's not even just about the traditional cigars, cigarettos.
Yeah.
We have the vapes, we have the shishas. You go out to a lounge, people are smoking, and you can't say anything because it feels like you are the one violating their privacy. And it is the other way around. And then there are fines for these things, but nobody knows about them.
Yeah.
So now it's not the problem of not being able to tell them that you are violating it. We also need to have the government to push that these laws are being enforced. We need to make them know that we need to make people that are violating it know that there are fines that are supposed to be attached to these things. There are even, I think, some months of sentencing that is even attached to these violations.
Right.
But a lot of people do not know. And then when you go to a public place and then you speak on, oh, you are not supposed to smoke here, it looks like you are the one that is violating their privacy.
You become the problem.
Yeah, you become the problem. So that's where the issues are.
Now, you mentioned something. You said those that are supposed to enforce the law are also breaking the law on their own. How then do you see the possibility of this laws being enforced if you've seen that particular problem there?
Okay, so first of all, before we even talk about the enforcement, we also have to talk about having a stronger regulation, because some of these regulations do not cover the new and emerging products. Rather, their definitions are not well defined in the laws.
Okay.
So that is where the first violation comes to play, because people feel because you are smoking shisha or because you are vaping and it has a more appealing smell does not mean it does not affect me. So now these people are violating the law. You see it, I think she spoke about seeing great men violating these laws. You see festivals, you see people making it look like, oh, when you smoke, it's attached to the identity of this festival, it's attached to a social identity, it gives you a sense of belonging. So these are the issues. These people are violating, and they are violating it publicly. So that is where the issues is. The issues are rather. So that is where we also push that the government needs to call their people to order. You cannot attach greatness or you cannot attach a certain sense of belonging to somebody smoking, and then you expect the youth not to do so.
That's right.
The young people not to do so, because well, we look up to big people, we have mentors, and if your mentor is doing it,
You just
You
know
feel
what
like, yeah.
All right. You spoke about young people, spoke about lifestyle countlessly, Lucas. You also have spoken about how people up there, the government needs to call them to order. But in fact, in your statement, you made mention of the fact that when you approach these people who engage in activities like this, it looks as though you are the one breaching their privacy. Now, I want measurable steps as to how these can be curtailed. Because we agree that the government can put up policy, implementation is such a big deal. How do you think a framework can be set up to sort this issue?
Well, we have existing frameworks, but just like every African society, we adapt without looking at the loopholes and contextualizing. And so these gaps that you would see makes it difficult for us to implement even the frameworks that we have. So we need to start with a review of the frameworks, looking at the gaps, seeking to assess the current situation and how we can actually step in to ensure that we address them. Then after that, awareness and accessibility. We all know that adolescent and young persons rarely read anything apart from school books that they are forced to read. And so we need to make sure that an abridged version of the law in several languages is available in majority of, and available and accessible, because we have had to reach areas whereby they do not have social media that much, but then this thing is also existing there, and so therefore there is a need for it to be accessible too. And then after that, there is a need for more funding. We currently have situations whereby there is a need for larger research all across the country to have statistical evidence to prove facts of the health risks related to this. But then there is no, the fund backing is not as much as it should be for something that kills up to 8 million people yearly. And so we also need funding. And then aside from that, there is a need for capacity building for first-time responders to this situation. Majority of the communities do not have key persons that can speak to adolescents about this. Even if you're speaking, you need to have the capacity to be able to answer the curious questions that comes with these situations. And so we also need that. And then we need our sanctions to be public. Publicly sanctioned people that violate as a sign of deterrence to others who do so, no matter who the person is. If we can take all of these steps, people will start taking it serious. And I believe if COVID dealt with us in terms of staying indoors, it means that as a nation, if we choose to make it an emergency, we can take the right steps.
You spoke about punitive measures as being a method of deterrence for young people, but there's a far-reaching issue which I think that we should talk about this morning, which is how these brands advertise what they sell. Now for vapes, in fact, I've heard countless times that they are not harmful. It's strawberry.
Safer options.
Exactly. You are selling in strawberries. You are selling in mango flavors. You're selling it in flavors that originally attract the younger generation. So if you are selling it like that and still claim that it is for adult consumption, the underlying reason for that is very obvious. How can this also be addressed much more than, you know, these punitive measures?
Well, addressing it is letting young persons know the flavor does not change the effect. No matter the flavor you are taking, you are still at risk. The person sitting next to you while you consume it is also at risk. So the fact that you have a preference, or there are several types available, and you have several categories of it. Okay, if I'm not using the usual cigarette, if I use the vape, it's more classy, it gives me a more sense of belonging, and then it is safer. It all has the same product. It's just that it is presented in a way that makes you feel like you're doing yourself good. Meanwhile, you are exposing yourself to more harm. And as a matter of fact, if we're going to be doing a comparison, if you are used to taking 10 cigarettes a day, if you sit down and take a pot of shisha, it's like taking almost 100 sticks of cigarettes in an hour. And so, but then shisha looks milder,
cuter,
you know, several flavors. You go to a high class environment to get it, but in 1 hour you have exposed your lungs to 1,000, 100,
You understand? But Blessing seems to look like she has a supporting argument to this.
Okay, no, not really a supporting argument. So one of the things that I feel like they started with, or the narrative they gave when they started pushing out vapes, is harm reduction. Okay, you said the traditional cigarettes is harmful. Yeah, we agree it's harmful. It has carcinogens. But this is harm reduction. And that phrase harm reduction does not exist. The only thing that exists in tobacco control is cessation. It's rather you stop or nothing. And then they've created this illusion with the flavors, with the designs. They've created this illusion that, oh, it's safer. And, you know, unlike the traditional cigarette that has the graphic health warning, this does not have graphic health warning. So there's nothing that is warning these people. And then it comes in very fancy designs. It's very attractive. It's sold at the cash points. It's colorful, which has made addiction way easier for youth than the addiction to the traditional cigarettes.
Right.
Yeah.
Now, let's talk about the causes again, because earlier you mentioned, you both made mention of the fact that young people look out for those that are influential in the society, celebrities, and of course the big shot, and we see them do this. That influence culture is there. But beyond these individuals who we see, you know, always sample the cigarettes or tobacco on screens, what other causes are there that has led young people, you know, to building the habit of smoking on a daily basis?
If you're going to look at it in terms of push and pull factors to the use of the substance, then we need to look beyond just the marketing and the psychology that comes with it. You look into the state of mental health of young persons, and still we will then relate it to the illusion that comes with it. If you have someone as young as 10, 11, 12 on the age that works on the streets, that is mostly child labor is the survival approach that they have, they will tend to easily get pushed, because people will start telling them, if you take this you get stronger. If you try this, I took it yesterday and it helped me, I forgot all the problems that I had. So they will be pushed, curiosity to try it, and then before you know it, they are now linked to the use anytime they feel like they need something as a push or support. And so in saying that, we need to also look at the challenges surrounding adolescent and young persons in their daily life, and how it can be a push or pull factor to them engaging or looking for a source of support. And then whether we like it or not, in all sincerity, the kind of support that used to exist in school systems, we do not have them today. The counseling units are no longer functioning. Even if they are there, they are just empty offices, and a teacher that does not even have the counseling background is just pushed there, so that in case any visitor comes, do you have a counselor? Yes, we do. Do you understand? So we need to create more safe spaces for young persons to be able to speak up about their challenges, their personal inner fights, in a place where they will not be shamed, they will not be labeled for what they are experiencing. If we can do that, then we will be able to take care of the other side that you're talking about.
Now, of course, you've talked about mental health, and one of the reasons why young persons, even at very early age, are being exposed to it. Now, what then can be done, you know, basically to ensure that children within our society, right, are not pushed to this at every point in time, you know, to help protect their mental health? What is the alternative that can be used as well?
Okay, so I think she has given a sort of context to that. But another thing is, we also need to review our curriculum in schools, because I know that when we were growing up, the curriculum taught us about say no to drugs, say no to cigarettes, say no to alcohol. But do this curriculum cover the realities of now? Do they also include the fact that you need to say no to vaping, to the use of nicotine pouches, or any sort of nicotine products? These are things that need to be reviewed and included in our curriculum. And then, speaking of mental health, there is a need for capacity building. We've been saying that there is a need for capacity building for teachers, for counselors within the school system. They need to understand that, okay, when these children come, first of all, there is no need to shame them, because at this age they are trying to explore, they are trying to find an identity. So it's based on what their friends are saying or what they hear people talking about outside that is making them, oh, okay, because this person is like this, I like this person, let me try it. And then some of these children, I'm sorry to say, but they also get it from home. There are people that their parents use it, they bring it to school, and then they bring it to school, they show other classmates, they experiment, and then they want to do that. So first of all, we need to train our health educators, we need to train youth educators, young people in the school. We need to review our curriculum. It needs to be included in our curriculum. And also, one of the major things I think that we don't think is a problem is the fact that these things are sold close to schools. These are in violation of our laws. There's a certain kilometer that is not supposed to be sold within a school premises. You go to the cash point, there's a ban on sale to minors, but these things are sold to minors. And a lot of these people, they don't know. The retailers at the grassroots, they really do not know that you even have these laws. So they sell it to minors. You go to supermarkets, you see young children with school uniforms coming to buy vapes, coming to buy nicotine pouches, and it's sold to them. So these are the things that we need to talk to our wards, we need to talk to our children, we need to start it from home. Because the school can do what the school can do.
That's right.
But at home, we need to train our children on what are the dangers of these things. We need to also create a room whereby our children feel safe enough to talk to us. Because unlike when we were growing up, mental health was really not a big deal. Everybody feels you should sort it out.
Surely.
But times have changed. There are a lot of things that are out in the market. We need to give our children a safe space to be able to talk to us, to be able to open their hearts to us, to pour out their hearts to us. Because if you don't guide them, the streets will train them. And that is where the dangers come. If you allow the street to train your child, it is difficult for you to go back and do any damage control, because at that point it's already too late.
All right. Now, you seem to, from your analysis, education seems to be like the major challenge that we face, especially when it comes to countering nicotine. And we know that the social media space now is very vast. So even if they don't get exposed in their environment, social media is there. I know television almost does not directly advertise for nicotine, vape, and all of those, but in movies and music videos and all of that sort, you see that there. So how do you think, or what practical steps do you think that the government can take towards the educating of young people concerning the risk of nicotine?
I would say they should do a combination of steps in terms of educating people. I know that when it comes to advertisement, movies, we have a body that checks these movies before it is being approved. And so if the body can be saddled with responsibility of checking and looking out for any product of such nature exhibited in anything that is going out, then they stop these movies. That's a sanction that will help us to reduce it. And the more we reduce it on our screen, and then we push forward education related programs, contents in terms of these things, you see that it will work interrelatedly to reduce it. And then when it comes to the music and the whether you like it or not, the same approach that they are using to get their product out there, we also need to use it to get our product out there. What is our product? No matter the style of nicotine products, the risk remains the same. So if they run 10 ads, we should be able to run hundreds.
So 100, I was thinking 20.
100.
Okay.
Because we are running a race against an algorithm that picks up in 1 to 5 seconds. So if in 5 seconds, I've already seen something that can attract me. And some of these ads, you can't even skip. And so they must watch till the end until... So why are we also not using that same approach? Yes. And then we also need to review all these regulations that comes with TikTok, Facebook, and X. We need to review as a country. Other countries are doing it to protect their
Nigeria is an open space.
But we are so open. However, in reviewing it, there is also a need to simplify these policies. You and I know that as Nigerians, anything that is more than 5 to 10 to 15 lines, all of us just agree and continue. Right? And so by the time you now give me a policy that is after the first paragraph, I've lost interest, I will not get there. And so we need to contextualize and operationalize these situations according to us and our target audience in this country. If we are able to do that, it will make it easy for education to go around. It will make it accessible to
All right. Funny story. While I was in the university, I was always sleeping. You know, I stayed off campus, right? But I was always sleeping. Time for exams, you know, I like to read in my room, but sleep does not allow me. So at that time, I was ignorant of what was the actual cause of that until I grew up and realized that the people who engaged in nicotine use and abuse within my environment exposed me to secondhand smoke, which is one thing I don't think people often speak about when it comes to the fight against nicotine. Can you educate us on that?
Okay, so when we talk about secondhand smoke, a lot of people feel that it's an illusion, it's not the reality. But we see a father that is smoking and his children are there. He might not get as sick as the children. Now, this let's look at the traditional cigarette butt. It even has filters.
Okay.
So when you that are taking it in, there's a filter. And then the person that is, the air that is being blown out, you that are the second-hand person that is there, you take it in
raw.
Yes, and then these people, if you notice, when they inhale it, they take it out. But for we just keep breathing in air around us, and then we are taking in these carcinogens. So a lot of people feel like it's an illusion, but it's not an illusion. It is the reality. We have statistics to back this up. People suffer more from second-hand smoke. We look at a lot of NCDs, and then when you look at a lot of NCDs, it has been stated that a lot of these are non-communicable diseases. Tobacco is like one of the major risk factors for it. We look at respiratory diseases, we look at different kinds of cancers. This secondhand smoke exposes you to over 16 different types of cancers. And it's the same thing with the vapes, it's the same thing with the shisha. Because it's the same thing that is in the air. It's just that, okay, now the smell is more tolerable than what it used to be. And so that is what people are being deceived with. Oh, okay, it's just cigarette that has the issue. Yeah, but vapes and shishas, no, they are safer. But they are not safer. If for anything, they're even worse than the usual cigarette. Because now, what is the most addictive chemical in the regular cigarette that we know? It's the nicotine. So now this has been extracted and put into a different container. Now there are no other things that are suppressing it, so it is in its raw form. So now it is more hazardous than the usual cigarette. But people do not know that. A lot of people really do not even know that. In fact, as we are sitting today, there are still people that will argue with you and tell you that no, vapes are safer. A lot of people, actually, a lot of educated people. So now this is what the industry did, because when it came out, they sold the idea of, oh, harm reduction, and then before we knew it, had already flooded the market. Right now in Nigeria, we have like over 573 different brands of vapes that are in circulation. They are not being, they are not being regulated.
That's an aggressive
influence. Yes, because it was their tactic. It was a targeted tactic, and then their major aim were for young people.
And they are achieving that.
They are achieving that. So that is where we have the problem. Because if you see now, most of our youth, there's reduction in productivity of young people of this generation compared to what we could handle before. But now this is it. And before we realized it, and what they hid under is like, oh, the law does not capture this. And then they keep selling the narrative of quit like Sweden.
Yeah. Some parents don't even know what the vapes look like.
Exactly.
And so even if your child is wielding one, you will not know what they are.
I saw one in a very cute bottle like that. It looked really
There are some
nice.
that come like pens.
Yes.
There are some that come like flash drives.
That's where the enlightenment comes
So that's where the enlightenment comes from. Ask your children. That is why I was talking about make the home a safe space. Ask your children, what is this you are holding? What have you learned today? Like, I have a nephew. I have like a 6-year-old nephew. We have very broad conversations. Even his parents laugh at me sometimes, but we have conversations. I don't even ask him like what did they teach you today. I just ask him, oh, what happened in school, so what did this person do? So he gives me, and you know, children are that they like to have conversations. So he gives me lots of conversations. He will even tell me the person that, oh, his mom did not bring him to school early because he did not do this. So like, have these conversations with your children.
Every nonsense,
every nonsense there is sense. And that is how sometimes, I think when he was growing up, I think around 4 or 5, when he started exploring and, oh, I like this sport, I don't like this sport, I like to play like this, we had to also, based on his conversations, we also had to choose the kind of friends he mingles with. So now these are the things that we need to also incorporate as parents, as words. We have to be intentional.
All right, thank you very much. Well, we're having a conversation right here centered around the World Tobacco Day. And we'll go to the break now. When we'll come back, we'll talk about some of the data that is available, some policies that are available, and of course, some of the solutions that we need to also pay attention to ensure that we have a tobacco-free society. Stay with us, we'll be back in the jiffy. Welcome back and thanks for staying with us. This is the second lap of the big conversation, and we've been talking about the World Tobacco Day. And of course, we've had Blessing Lewis here with us, and also because Yusuf with us. Once again, thank you for being here with us.
Thank you very much.
Thank you.
Now let's talk about some of the data that we've seen. According to WHO, it says that good decision must be based on data, on strong data, like National Tobacco Service. Now here in Nigeria, how strong is Nigeria's current data on tobacco use? Do we even have the data to start with?
We have the GATS. I think it has to do with data on tobacco use. We also have, we have a database called the Tobacco Control Data Initiative.
Okay.
So now every data that has to do with tobacco use, tobacco industry interference, violations of the laws, you find it there. But a lot of times it's not about the data or the research we have. So sometimes what the tobacco industry have been doing is, because whether we like it or not, they have the funding and we do not. They have the money and we do not. So these people, they create bogus research. They create bogus scientific research and be like, oh, okay, we have found out that these things are not hazardous. Okay, give us your research. Let us see. Let us cross-check it with ours. And that is where you don't hear anything. We also have academic papers. We also have investigative journalists that have published things about this. You see, we have the tobacco tactics. That is now, this is to bring it down to how the tobacco industry markets their goods, what they do, how they do subtle marketing that we do not know. Because in our laws, we have the ban on tobacco advertising, promotion and sponsorships. So now what have they done? With the new form of social media, they have decided to do a lifestyle marketing. That is the approach they use, using celebrities, influencers. We have data on this, but like my colleague stated earlier, our problem is usually funding. And one of the things that we also push for is for sustainable financing, because this is a health risk, this is a health issue. We need to incorporate it into our health projects. The government needs to incorporate it into our health projects, because without that, whether we like it or not, donor funding, it will always elapse.
Right.
It's just a matter of time. And then when right now we are experiencing donor fatigue. A lot of donors are pulling back because, well, they cannot continue to keep spoon feeding us. We need to take ownership of some of our projects. We need to take ownership of some of our programs within the country. But when you talk about data, we have data. We even have youth data on tobacco use.
Okay.
We also have youth tobacco survey. So these are all data that we have. We have research, we have academic papers, but what to do with it is where the problem is. The government are really not interested. They feel like this is really not an issue now. And with the way we are looking at it, it's becoming a pandemic.
You said the government is really not interested. Now, has there been any form of engagement that made you say that the government is not interested?
Okay, so we've been looking at reviewing our laws. So right now, what we are doing is, let's first of all leave the national level. Let's go to the state. So now what we are doing at the state levels, we are working currently at Imo and River State. It's one state at a time.
Yeah.
We're pushing for smoke-free policies. And then in these smoke-free policies, we're helping them review their law, review your law so that they can capture these new and emerging products. Because a lot of times we look at it like, oh, these are not within the law. But when we start working at state level, I feel like enforcements are easier when they are coming from the states. Because now we have the State Ministry of Health, State Ministry of Justice, State Ministry of Environment, because it's not just one ministry. Like we said, it's MDAs. We have the Ministry of Environment, Ministry of Justice, Ministry of Health. All of them are supposed to be part of this. But you see, right now, at the federal level, the government have like other priorities, so to say. So this is like a lesser priority to them right now. So this is not really their area of focus. But when we now moving to the states, we've seen that they are more proactive. Yes, they are more interested in reviewing their laws, because they are the ones that even want to review their laws, not us. They have called us because they feel like, oh, they need to review their laws. This is becoming a pandemic. So they are now reviewing their laws. Even the fines that were being put 5,000, 10,000. You see hotels, maybe they are paying like 20,000. That's nothing. So now we're also reviewing those fines within the state level. And when we see that 1 or 2 or 3 states have started having like a stronger smoke-free policies, we noticed that, based on research, we've seen that other states are now more interested in that.
But don't you think that that would be a bit difficult, because this is considered a legitimate consumer product?
Yeah.
So it is already legitimized in Nigeria to be sold in Nigeria. but you want the state to implement smoke-free policies.
So now, smoke-free policies is not just about, it's a legal product, yes, we know. But now, smoke-free policies is also a regulation, because we need frameworks, we need policies that will curtail these things. We know that in the past we were talking about DSAs, that's designated smoking areas, and based on research we've seen that that does not work, because if you smoke here, air cannot be trapped, it will go out. So the fact that we are pushing for smoke-free policies is not about the industry themselves, it's also about the public health, it's about the citizens, the people that are being exposed. The fact that I do not smoke does not mean that I have to pay for the sins of somebody else. If I decide that I do not want to harm myself, I care about my health, but somebody else is smoking, is a problem. You go to the parks, people are smoking, you go to lounges. Now you cannot even say you want to go out and have a good time, because everywhere you go to restaurants, you see people smoking. And then you can't tell them no, because if the restaurant policy says that they can smoke, who are you to come and say otherwise? So these are the things that we want them to put into place. At a public places, people should not be, you can go and smoke in your house, that is between you and your family member. If you want to harm your family members, that's fine. You can't smoke in schools.
You know, there are several products that have been legitimized.
Yes.
But their safety still calls into question. And it also applies here.
So why, that's the question, why is it being legitimized when it obviously has killed almost half of its users?
Well, when it comes to registering businesses, initially with the history of it coming in, we did not have all these policies in place as at there. What we can decide to do now is to review the legitimacy of it in our economy. But like I said, with the corporate social responsibility these organizations are taking, and how far they have gone in attaching it to our culture, to our norms, our values and lifestyle, it's a lot of work, but we can start somewhere by reviewing the legitimacy, by having a sit down with these organizations. In fact, reduce the number of producers that we have by reviewing how they came in, what they are doing, and how they have affected us, all of us in general, either primary or secondary. If we can start from there, it would. But then we all know that's a far-reaching level. So we can do enlightenment and accessibility to information and monitoring and data collection and research to start with, to protect the people, while we'll now try to get them to see reasons to either non-legitimize it, take back the legitimacy
of it.
Or yes.
Is that possible?
It is, if we choose to.
Yeah, but also,
as a country.
yeah, so also I think another thing that we
that
also need to keep in mind is why we cannot ban these products is the fact that now we'll not be able to control it. There will be like a vast increase in illicit trading. We've seen this history with products like marijuana. Marijuana is not a legal product, but it's everywhere. So now you cannot make laws or make policies that will control this product because it's not a legal product. So when we do that, what we are doing is that we are risking people more. Because when you say that you've banned this product, it will saturate the market in a way that you never expected, and they will still make money, and then you do not have laws against this thing. Because if you say now, do you want to come and say that okay, you've banned cigarettes, but you want to come and create a policy or a law or a regulation that controls the smoke of cigarettes in public places? It's not possible. So banned products, you cannot create laws and policies.
And aside from that, we are going to go into a crash.
Yes.
We do not have support systems to help those that are already addicted through it. And so if you have people in millions that depend on this to live daily, and you stop the access totally, we are going to crash.
Now, some of the measures that WHO actually brought on board as to help curtail smoking is the high taxes, the ban of advertising when it comes to this product, and of course massive education campaigns basically. Now, if you were to speak with the government today, what are the three for you as an organization? What are the three main campaigns that you want to bring on board to ensuring that these are the things that must be done and done vigorously to ensure that people are more educated and we can achieve a smoke-free society?
Okay, so first of all, Nigeria is part of the WHO Framework Convention on Tobacco Control. Nigeria signed a treaty. So our laws were supposed to be based on WHO recommendations, but we all know there's cultural context, there has to be back and forth, and we also always have to have a middle ground. So if we look at our laws, has I think over 13 provisions. There's the ban on advertising, ban on sale to minors, there's the ban on increased taxation. And what they keep pushing is that what the government does not know, that when you increase tax, it makes more revenue for the government. But what this tobacco industry have tried to say is that when they increase tax, it's going to increase smuggling, illicit trading. But that's not true, because the tobacco industry, they're not the ones paying the tax, we are. So when there's an increase in tax, there's an increase in the price of that product. And whether we like it or not, we've seen it with our economy now. Increase in certain cost of living has made us to reduce. So when there's an increase in tax, statistics have shown that there will be a reduction in consumption. But now that is not what they want. They are still trying to keep the tax like very little. And why is it that something as hazardous and as dangerous and as deadly as cigarettes is that cheap and that affordable? It's not supposed to be that accessible to everybody. So taxation is one of the biggest things that we've been pushing for years. And then there's always the promise of, oh, okay, don't worry, we'll work on it. And even the ECOWAS, there's, apart from the WHO standard, we also have the ECOWAS standard. And Nigeria is way below even the ECOWAS standard of taxation on this product.
So where do you see us, like on this scale, where do you see us regarding the fight against tobacco, the use of tobacco?
We're not even on a scale. We've not gotten there.
Well, we haven't.
And that's
we've not gotten there.
Yeah.
It is, and that is why there is a need to pay more attention to certain aspects of the WHO FCTC so that we can save ourselves. We are not even on the scale. I won't lie to you. In this war, we are losing. If we can do accessibility reduction, and a review of even the new and emerging products, it will go a long way. Let's call them back until there are policies that cover them. If we start from there, we can say, okay, yes, we want government to take these initial steps, and then we go from there. And aside from that, the sale close to adolescent and young persons is another focus, because the catch them young theory is something that they are strongly depending on to continue having people. As much as the ones that use it are dying, they are having new customers by the day. So we also need the government to focus on that aspect. And then another aspect is educating people about the existing laws that are protecting them. So that you and I will not be in every community, in every street. But if people have access to this information, they will know what to do and the steps to take to protect their immediate community. So if we reduce the supply, take back these things that are not evidently seen in the existing legal policies, and we also reduce access for adolescent and young persons, it's a good start.
Let's quickly talk about one of those laws right now, because again, she made mention of secondhand smoking and the effect it has basically. Now, if I'm also in a very open place and then someone consistently smokes within that particular place, I want to take responsibility. For instance, what body am I supposed to talk to report such a matter that in this place there's a constant open smoking here, which of course affects those who do not smoke here?
One thing that we always look at is the need for us to report to a body.
Exactly.
Social media is a body. Why do I say so?
Okay.
In building structure and referral system from community level all the way to the national body, we do not have the funding or the personnel or the capacity right now. It is supposed to be in such a way that we have first responders, like I mentioned earlier, that are trained to pick up on these things. As a matter of fact, go around the community to seek out people that are violating, which is why we have the monitoring teams, so that they now report, and then necessary steps is being taken from the community level or the state level. But how many of these states do we have functioning monitoring teams that are properly funded for them to do this? However, one thing that NTCA does and does well is to keep up with the trends on these social media platforms. So if you are to, for example, now see something that has been violated in terms of any of the laws, all you need to do is to make sure that you have a proof of the violation. But then keep in mind that recording people also has a policy against it.
You see, it's too,
And so-
it's too complicated. It is
And so,
very
in as much
complicated.
as that is what you want to do, what you can do is to speak about your experience in that place. If you're here and I'm smoking and the smoke is coming to your face, you can pick out your phone. I am here at so, and as you can see, I have smokes around me, and according to the laws and the policies, it is said that secondary smoking this, and then I am calling on for action. You see that now, if we check through the recent policies and that particular environment is not supposed to have that kind of exposure, we can take action.
Alright.
You are not recording anybody.
I would have asked
So
how
we-
strict your action would be, but again, you guys
There's like another exactly.
Exactly.
And I'm just imagining this headline you have just like come up about on like one of the major blogs, maybe like an Insta blog or something, and the responses you'd get there, you'd be shocked to know.
Yes.
You would be shocked to find out that it will be against the
Of
reporter.
course.
Right.
Yes.
You know. But let's just go just in a few seconds. Your concluding thought when it comes to achieving a smoke-free society. What's going to be advised to young people out there?
So first of all, like we've stated earlier, there is a need for youth education. Youth need to be properly sensitized on the dangers of these things. It's not just about social identity, it's not about influence, it's about the health risks. And then it might not show now, it's just a matter of time. It's like long term. And then what we are trying to see is that we do not wipe out the whole next generation based off of what the industry is selling, because whether we like it or not, tobacco industry does not care about your health.
Right.
They care about the profits they make.
Okay.
There's need for digital and social media education too. Parents need to sensitize their kids, have a very cordial relationship with your children. I'm not saying that your children must be your friends. Your children are not your friends,
But have that relationship.
but have a very
Alright.
good relationship
Thank
with
you.
them.
Because just very quickly as well.
For me, I was tipped off by the recent festival and how actively mothers and women are now using this product. So I am calling on women to know that whether we like it or not, we are in charge of whatever it is that happens around us. Yes, we are. Yes, we are.
Let's land that point.
Yes,
We're going to talk about this after the show.
No problem. And I say that because I know of feminism, I know of femininity, I know of ascribed definitions that comes with feminism. However, whether we like it or not, we play a critical role model. How will I put it now? We are mentors whether we like it or not. I'm trying now to run away from the discussion
we're
after.
going to talk-
And so
we're going to
I
talk
am
about it.
actually worried, and so I am calling for young persons, for mothers, to look beyond what they see in terms of anything that they are putting in their mouth,
All right.
in their body.
All right. Thank you so much.
Thank you.
Well, we'll be talking with first Blessing Louis Yashim, Monitoring and Evaluation Project Officer, Nigerian Tobacco Control Alliance, and BKS Yusuf, Programs Officer, Nigerian Tobacco Control Alliance. Thank you so much for being here with us. We appreciate
you
it.
so
Thank
much.
you.
Thank you very much for having us.
But of course, achieving a free smoke society is the goal that we're all looking at for here. And of course, just like our guests have said, calling on the government, enforce this policy, educate the people, and let's have this quickly implemented in our laws.
And it is everybody's responsibility.
It is.
Male or female. Like, it is everybody's responsibility. And if we must fight against it, then we must, look for stronger ways to doing that.
All right, that being said, this is all we're going to be taking on today's edition of Rapid Done. Do remember that you can follow us across all of our social media pages across all platforms at Rapid TV, and of course on YouTube, where you can get to watch all our episodes. It is at Official Rapid TV, and wherever you are in the world, you can watch us live using our website www.arabianradiotv.com. My name is Victor. Okay,
My name is Martha Alu. Thanks for joining us, and we will see you tomorrow.
see you tomorrow.